Our mental health system is in shambles. I don't think anyone would disagree with that, even Democrats. I don't know how you can look at what's playing out on our streets. The homeless crisis is a drug crisis and a mental health crisis. You have a lot of people dealing with both. The following segment is presented in partnership with Future 42. Turn your frustration into action at future42.org. We've heard promises for a long time in our state that there was going to be a prioritization of fixing our mental health system, that we were going to spend money on the issue and it was going to get better. But the Seattle Times had a really interesting article looking back at 2018, and I'm going to play this clip for you. This is Governor Jay Inlsee in 2018 standing outside Western State Hospital, the state's largest psychiatric facility, which is absolutely in shambles and crumbling, and promising that they were going to make things better by 2023. Watch.
By 2023, we intend to have about a dozen 16-bed state-run facilities located throughout the state of Washington. And in cooperation with our community partners, we will have built a network of private hospital beds and supportive housing units and other community-based settings for patients who don't necessarily need to be in hospitals, but still need some level of care. Now, this is a heavy lift. It is an ambitious schedule, and it means we will need to fund upfront costs and make some difficult budget decisions. But 2023 is a doable deadline, and it is necessary. And I want to make this point. Because this will require some difficult decisions, we do need a deadline.
That's interesting. I'm racking my brain to think of what year it is. What year is it? Oh, that's right. It's 2023. And it is quite clear that those commitments and the promises that Governor Jay Inlsee was making while standing in front of Western State Hospital in 2018 have not come to fruition. And the Seattle Times had an excellent article diving into all of this and stating the obvious, which is that those plans and those promises have simply not been fulfilled. And big credit to the Seattle Times for doing this really deep dive into the beds that are available or not available, promised beds that haven't come to fruition. In the article, the Times writes that as of right now, there are no walk-in crisis centers in King County. And by and large, hospital emergency rooms and jails take the responsibility for caring for people despite the high cost and being ill-equipped to treat people in psychiatric emergencies. And I'm sure you've heard of the stories by now. We have people who have committed violent crimes, including a guy who stabbed a woman at a bus stop, threw an elderly nurse down the stairs, and then killed a homeless man with a piece of rebar, who the state has actually had to pay money ordered by a judge because they haven't got him the psychiatric care that he is supposed to get. And so now our mental health system is in such a state of disrepair, 5 years after the governor promised what he promised in that clip. It's so bad that we're actually paying violent criminals because we're not able to get them the care that they need. And so this all brings me back to what the governor is trying to do in his final year in office. And that is he's trying to get billions of dollars committed to primarily housing. But he also says to help with substance abuse and mental health issues. And need I remind you of what he said in that clip in 2018? Basically, this is going to be hard. We want to do this by 2023, but we're going to have to get some more money. We're going to have to make some tough budget decisions. And I can't help but see a lot of parity to what the governor is saying right now about fixing the homelessness issue, substance abuse, mental health. Oh, this is going to be hard. This isn't easy. In the next 6 years, we want to build such and such numbers of affordable housing units, but we need more money. This is a pattern. This is a pattern of failure. This is a pattern of telling you that he's going to get something done if only he can get a little more money. In this case, a lot of more money. Billions of dollars. We have to ask ourselves, at what point do you stop believing him? At what point do you look at someone who's been the governor for 11 years and say, this has gotten worse under your leadership? The state's largest psychiatric hospital lost its federal certification under your leadership. You promised us results in 2018 by 2023. Those results have not manifested.
It is an ambitious schedule, and it means we will need to fund upfront costs and make some difficult budget decisions. But 2023 is a doable deadline, and it is necessary.
I don't think that Governor Jay Inlsee and whatever solutions he might float are worth dumping another dime into. And his own words in 2018 prove that. The previous segment was brought to you in partnership with Future 42. Turn your frustration into action at future42.org.